This is nurse practitioner Rachee Hatfield, and she's going to go over the programs available for our survivorship program.
Thank you. Good afternoon. I have to start by apologizing for my voice. I've been fighting a pretty stubborn respiratory infection, cold, whatever it may be. So I'll do my best not to cough at you as I'm speaking. But I'm happy to be here today just to share with you a little bit of an overview about our cancer support clinic. You may also hear referred to as survivorship here at the James. Just to start with a little bit of information about our clinic mission and why we feel what we do is important. Cancer survivorship is something that begins at the time of diagnosis and continues throughout a person's life. We also realize that cancer can and often does affect people not only physically, but also in other domains, emotionally, mentally, has financial impact or impact on practical issues as well. It also affects not just the patient, but it affects families and it affects relationships. We also recognize that needs of a cancer patient are different, and they change from the time of initial diagnosis. They be different during treatment, after treatment, and then in the years after that as well, throughout the end of life. And each patient's needs are unique, so part of what we try to do is support those unique individual needs and provide supportive care resources to each patient. Our overarching goal, though, is to help you as cancer survivors manage issues that may arise from treatment in order to improve your overall health, well-being, and quality of life. Okay. All right, so just a little bit of information about sort of contact or where our clinic is located, who it's available to. This is our main clinic phone number that gets a hold of our scheduling team. Our main location is located at Martha Moore House Tower over on Kenny Road on the 6th floor. We also have a satellite location located just down the street here at the Stephanie Spielman Comprehensive Breast Center, where we see only breast and gynecology patients. Everybody else, such as yourselves with melanoma, would be seen over at the Martha Moore House Tower. Our clinic is open to any James patient at any point on their cancer journey. Again, I mentioned from the time of diagnosis through treatment or afterwards. A large part of what we do is kind of assess each patient's individual needs, through a visit or a consultation, and help to facilitate referral to different resources that are available, not only through our supportive care clinic, but sometimes also referrals to other supportive care specialties. This is a nurse practitioner-driven clinic. We are staffed by 5 nurse practitioners. I work with breast patients. I'm located over at the Stephanie Spielman Breast Center, along with my colleague Denise Schemming. And then over at Martha Moore House Tower, we have Dory Klemanski as our clinical director for our program, and then Rupa Ghosh-Burkabile and Christy Browning are also nurse practitioners that work with our program. Patrick is a nurse that has sort of an expertise and a lot of knowledge on men's sexual health and fertility preservation, so he works a lot with that population. And then we also have a fertility preservation program that's available to both men and to women. For our women, we have a gynecologist that specializes in fertility preservation, and then we also recently just had a nurse practitioner come on board working with her, Mary Caldwell, and then we just hired a nurse practitioner to work with the men's sexual health arm, and she'll be starting in July, I believe. So just to get started with some of the different services and resources that we have available, this is kind of supporting more of the emotional or spiritual aspect. We do have counseling services available, and that is staffed by, we have 4 psychologists, and then we also have 3 clinical social workers that provide counseling or emotional support, if there's difficulty coping with different aspects of cancer diagnosis and treatment. These folks are available at both sites, both at the Martha Morehouse Tower and at the Breast Center. And then as far as spiritual care goes, we do have chaplains also available at both sites. And it's really multi-faith. It's not any one specific faith that they provide support for. Sort of another resource, maybe a little less traditional than providing one-on-one counseling, but also meant to help support emotional needs and sometimes the physical side effects as well of cancer treatment. We do have art therapy that's overseen by an art therapist, Ann Harding. She does provide individual sessions, but she also does group sessions as well, group therapy, to help patients transition from active treatment to post-treatment survivorship. And art therapy can be helpful with kind of the following issues listed there. So it can be actually used to help handle anxiety, adjusting and coping with cancer diagnosis, and expressing emotions in sort of a nonverbal fashion. Also to help with body image issues. We also have music therapy, again, staffed by a master's trained music therapist who offers individual sessions as well. And music is something that can be utilized to help with some of the physical side effects even of treatment for a lot of our patients, especially those that receive chemotherapy will kind of experience cognitive dysfunction related to that treatment, also known as chemo brain. Anxiety, difficulty with sleeping, pain, again, grief or body image issues or vocal changes. So these are all things that music therapy can help support. Moving into sort of the domain of oncology rehab, we do offer massage therapy, something we've been able to offer to all of our cancer survivors. Staffed by 2, it's one of the more popular things, yes. 2 licensed medical massage therapists, again, one over at the Breast Center, one over at Martha Morehouse Tower. Access or referral to this service does require clearance and a visit with one of our nurse practitioners prior to the first visit. Or we also like to kind of do a holistic assessment, see what other sort of needs one might have, and if we have any other supportive care services that might be of use or of interest. This program allows each of our patients up to 6 lifetime massages. We're fortunate to be able to offer it at no charge. It's something that's paid for by grant money so that we could offer that to our patients. It may also, if you're interested, incorporate things like aromatherapy, guided imagery, mindfulness, and sleep hygiene education. It's really meant to be about providing some relaxation. Also, under kind of the rehab arm, we do have physical and occupational therapists for part of what they do. We do have a program that can help with fatigue management or intervention in combination of sort of meeting with the occupational therapist to do some education about energy conservation and sort of planning the days to help manage fatigue. And then sort of on the flip side of that, also meeting with a physical therapist to kind of develop an exercise or walking program. We call that our fatigue intervention program. May also help with things like functional impairment related to treatment, neuropathy, or lymphedema. Our occupational therapist, another sort of domain that they help with assessment and management techniques is cognitive impairment. They can do screening for that to kind of figure out where one might be struggling in particular. sort of adaptive tasks or even adaptive equipment like bracing, and I already mentioned neuropathy. Oh, here's where the fatigue intervention program has gone over. It's 4 consecutive weeks meeting with a physical therapist for an exercise and walking program and the occupational therapist for some fatigue intervention strategies. That's just once a week for a 4-week period. And then something else that we do pair sometimes with the occupational therapist and the music therapist to help with is cognitive dysfunction or chemo brain. We have 2 physicians that are specialists in physical medicine and rehabilitation. So that could be sort of addressing from different areas, but one of our physicians, Dr. Luke, she does a lot of interventional procedures or interventional strategies for pain management, things like injections, things like that are alternatives, maybe when opioids are ineffective or not recommended. And they also work very closely with our physical therapy team and with our psychology team as well. Sort of other ancillary services that we have, we do offer nutrition services, and we have registered dietitians that can help address different aspects of nutritional needs, but they may be helpful for developing strategies just for healthy eating, for weight gain or weight loss, depending on what one's individual needs are. We also have our sexual health program, so this is something that is available to both men and to women, and maybe referrals to things like our physical therapy team for pelvic floor rehab, maybe in particular for like our gynecology patients that have had surgery or radiation that's kind of affected the pelvic floor, but and then also made referrals to urology or gynecology. We just recently added a sex therapist to our staff, so sort of addressing sexual issues that may arise either for individuals or for couples, and she will see individuals and couples for sex therapy. And then I think, as I kind of mentioned previously, we do have a fertility preservation program. For our men, we have a urologist, Dr. Jenkins, that specializes in that. And then for women, we have Dr. Apia, and she is a gynecologist that we would refer to. Another one of the services that we provide, and something that is sort of a standard now through the Commission on Cancer, is providing a cancer survivorship treatment summary and survivorship care plan to patients at the end of treatment. And this is about a 3 to 4 page document. We ideally prefer to provide to you within 6 months of completion of treatment if you're in sort of the surveillance phase, where you're getting that close follow-up, maybe with scans and our clinic visits every 3 to 6 months. What this document provides is details about the cancer treatment that each individual had. So it's going to go over the different sort of modalities that were included from time to diagnosis, whether there's radiation, chemotherapy, all those different modalities involved, dates, types of drugs. So it's kind of a nice detailed summary for your records that we also send on to your primary care doctor or any other providers that you would see on a regular basis for communication. It's also going to go over and include information about side effects related to your particular treatment, both immediate and possible later long-term ones, which are your healthcare professionals to see for follow-up, whether it's something that you'll be following with your oncology team or with your primary care doctor, signs and symptoms to watch for that could be concerning for cancer recurrence. And then just some education recommendations for health maintenance, so things like nutrition, physical activity, tobacco, alcohol, and whether kind of general cancer screenings and health maintenance are recommended. This is something that can be provided by your primary oncology team. And for some of the service lines, a lot of the nurse practitioners are doing that, but it's something that we also provide in our cancer support clinic. James Care for Life is sort of another arm of our supportive care clinic. Some of you may be familiar with. It offers supportive resources both to patients and to caregivers. What it is really it's a series of programs or group resources for education, physical activity or exercise, things they offer like yoga. There's a stretch program. There are art and music offerings as well, offerings that fall sort of under the category more of mind, body, spirit, things like an urban Zen program, mindfulness, kind of stress reduction techniques. There are nutrition-specific offerings, and then things that are offered also for families, teens, and children to do together. There's also, a lot of these things are programs that are offered locally and involve attending in person, but there are some online resources available through James Care for Life too. A couple of those domains, I know some of the education offerings have a live stream option, and then I know that one of the nutrition offerings is a web-based email program. And then there's also a video library through the website there that has pre-recorded topics on a lot of different health-related issues. I think there's about 30-something videos on there now, and that's something they're always adding to that it can just be accessed easily from whenever, so long as you have an internet access. So that kind of wraps up my presentation. Thank you for your attention. I'm happy to answer any questions.